So what is Lhins? Lhins stands for Local Health Integration Networks and is the future of Ontario's healthcare system. Lhins was created by the Ontario government in March 2006. Lhins consists of 14 not-for-profit corporations who work with local health providers and community members to determine the health service priorities of different regions in Ontario. Lhins understands that a community's health needs and priorities are best understood by the people living within those communities and is now shifting Ontario's unorganized healthcare system to more client-focused to better meet the needs of the people. It is important to understand that Lhins does not directly fund services, but they are given the power by the government to plan, integrate, and redirect fundings to healthcare services where needed. And right now, they oversee nearly 2/3 of the $37.9 billion in healthcare budget in Ontario. There are 14 Lhins across Ontario, and they plan to integrate and fund local health services including hospitals, community access centers and community support services, community health centers, long-term care, mental health, and addiction services for each regions. This initiative is part of the McGuinty government's plan to build a healthcare system that delivers on 3 priorities: keeping Ontarians healthy, leading to stronger communities, reducing wait times, and providing better access to doctors and nurses and other healthcare providers. How you can get involved. Go to the Lhins website, find your Lhins, go to Get Involved. You can either become a board member, join advisory panel committees, and mainly attend Lhins board meetings and other Lhins events to get your voice heard. In order for Lhins to work, there has to be communication from the community. There has to be participation, as this results in consultation and education of all involved to better meet the needs of the community. It's all about engagement. What was wrong with our previous healthcare system? Services were fragmented all over the community. Health programs were largely funded and managed independently of one another, leaving Ontarians navigating in a chaotic system of services, which caused longer wait times and decreased health status. Healthcare consumers are dependent on those organizations to work together to flow in one process to provide better and faster services. From a chaotic system emerges a stable, structured system. The structure, or the system in this case, is Lhins. It exists to serve the processes, and these processes are the services, all moving in one direction to serve client-centered goals.
Hello, my name is Diane. I'm from the nursing program. Is it alright if I ask a couple of questions?
Yeah.
Alright, well starting off, do you know what Lhins is?
Actually, prior to this questionnaire, I didn't know what it was. So, but upon learning about it, I'm interested in answering the questions. So.
Okay, that's great. So, from what we've talked about, now are you able to tell us what Lhins is?
Mm-hmm. It's a service that basically helps to eliminate wait times for patients, I guess, in Ontario. Sending them to different centers depending on what their needs are, as opposed to having them wait for longer to get the services that they need.
And that's great. And basically, personally, what's your attitude about this?
Well, I think that it's from the little bit that I know that anything that's going to help reduce the wait times is important. I know personal family experience having someone having to go to the US to get care because the wait time was just too long, and I think that was just something that shouldn't have happened, and so anything that will help reduce wait times here I think is good.
So personally, you would support it then?
I would definitely support it.
Alright,
I do.
I'm kind of mixed between, but ultimately it is what the government says that goes. So.
Do you know what Lhins is by any chance?
No.
Have you ever heard about it before?
No.
Basically, do you know what Lhins stands for? Well, what it stands for is Local Health Integration Networks. Does that ring a bell?
Not really.